Greetings, my name is Megan Franzen and I am with Patients Medical. We're a holistic medical center here in the heart of New York City, Midtown East. We're actually on 2nd Avenue between 42nd and 43rd Streets, and I'm here with Dr. Kamau Kokayi, who is our senior staff physician. You want to say hello, Dr. Kokayi?
Greetings.
And we are here today to discuss why you might want to choose holistic medicine and some differences between holistic and conventional medicine. So first I'm going to tell you a little bit about Patients Medical, who we are, and where we're located. So as I said, we are a full-service holistic medical center in Midtown East. And what does full service mean? We have a range of services, very wide range of services that include diagnostic testing, sonography, bone scanning and bone density tests. We have many other different types of laboratory tests that our doctors use, and we have everything from general practitioners to specialists, and we can take care of most patients from the beginning to the end of their medical experience. And we're constantly expanding to include spa procedures and many other very advanced techniques, which we'll kind of talk about a little bit later. But for more information, go to our website and see the other things that we offer. Discover health, rediscover vitality. That is Patients Medical's motto. What does that mean? It means that there are so many people, especially here in New York City, walking around and feeling really, truly miserable, but they don't even realize that they feel miserable until they come and see one of our doctors and realize they can feel much better. So they assume that it's normal to be low on energy and tired and slightly depressed and just kind of uninspired with life, when they realize that with even a few minor changes to their diet, to their hormones, to their thyroid, they can feel really great all day, pretty much every day. And that's very exciting to most of our patients. Our doctors focus on the root cause of symptoms. So, for instance, if you come in with a particular symptom, instead of just being handed a pharmaceutical that will cover up the symptom, our doctors prefer to use the symptom as a roadmap to actually what's going on, what your body is trying to communicate. So definitely we do not want to cover up the symptoms. We want to use it. Our doctors integrate modern medicine, holistic practices, and natural supplements to give you the best medical experience that you can. So really combining those things, the best of each world, to give you the best care available. Our goal is not to just put a Band-Aid on whatever your symptom is, but actually to promote healing and prevent disease, which is kind of a novel approach in this day and age, actually being able to do things to kind of head the disease off before it starts running your life. Our physicians collaborate to approach each patient holistically. So that means that if you're seeing a general practitioner and a specialist and possibly another practitioner, they will work together to create a wellness plan that is cohesive, that makes sense to the patient and is easy to follow. The result is to gain health and nutritional wisdom that can be applied for years to come. So the advice and treatment plans our doctors offer aren't just good for that particular moment. A lot of this nutritional wisdom and the supplements and just the philosophy of approaching the body from a whole body perspective, that can be used not only for yourself but your whole family for many, many years. Our founder is Dr. Warren Levin, and he began practicing his groundbreaking holistic protocols in 1974. Our medical director, Dr. Rashmi Gulati, began studying with him at several years after that in the 90s, and then began acquiring some of his holistic protocols and integrating them into her own practice. And that's kind of where Patients Medical started. Of course, it wasn't called Patients Medical back then, but now Dr. Levin has been semi-retired, and Dr. Gulati took the practice over, and we have many holistic doctors here who have taken these groundbreaking protocols and made them into what they are today, which Dr. Kokayi is going to say more about in just a few moments. We treat a variety of many different types of syndromes, diseases, imbalances. This is just a short list. Our staff includes internal medicine, family practice, gynecology, oncology, hematology, immunology, pain management, and many other things. As we said before, just really creating an integrative medicine experience for each patient. So today's speaker is Dr. Kamau Kokayi, as I said before. He is a holistic medicine doctor. He's also in charge of stem cell therapy here at Patients Medical and is our senior staff physician. He received his medical doctorate from Yale and completed his residency with board certification in family medicine. He's also certified in acupuncture, Chinese and herbal medicine, applied kinesiology, and homeopathy, among many other things. He has over 25 years experience in integrative medicine, and his specialties are many. These are just a few of them: nutrition, detoxification, chelation therapy, intravenous therapy, acupuncture, homeopathy, structural manipulation, energy medicine, and many more. So that well qualifies him to talk to us today about exactly what is holistic medicine and why you might want to use it. So without further ado, Dr. Kokayi, let's just dive right into this. Just on a very basic kind of pedestrian level, can you tell us what is holistic medicine and how does it differ from conventional medicine?
Well, I think most people, when we say conventional medicine, they're really referring to what's called allopathic medicine. I'm sure a regular doctor visited with a physician who's been trained in a certified Western medical school. And that is a certain approach which most of us become acclimated to as a result of just coming up in this society. You go to the doctor, they check your blood pressure, your heart rate, your temperature. You might get a shot, you might be given pills to take, and that's conventional medicine, and that works within a particular framework that focuses in on a person's biochemistry and to some degree their structural integrity. Holistic medicine, on the other hand, implies something else, and that's basically, we first heard the term holistic, and it really referred to everything else beside conventional medicine. But somehow it implies that there are other things that are taken into account. Those other things can be other aspects of biochemical realities that people deal with, such as their diet, such as the use of vitamins and supplements. So by the same token, holistic medicine can also refer to the medical systems that are used in other cultures, whether it's talking about Chinese medicine, Ayurvedic medicine, shamanic healing. It can also refer to other traditions that have come up within this country, whether we're talking about chiropractic, whether we're talking about kinesiology or craniosacral therapy. So the real question is, both for the practitioner and the patient, is one, to get an understanding of these other therapies and how do they actually mesh with conventional medicine. How do you actually use these things together or even independently of each other?
And that's the real question too, right? Do we use these together? Do we use them separately? Do you really have to choose, and how? So tell us a little bit more about what people might usually get when they go and see a conventional medical doctor. Maybe they have a symptom, maybe they have an ache or a pain or something going on, and they're referred to a specialist.
Well, the problem really with conventional medicine is good if you have serious pathology, meaning that they uncover there's a mass that was found or something that where there's been a gross change in what's going on in your body. But for the most part, many of us are walking wounded. You go in, you may not be feeling well, but unless it shows up on your blood work or if it's really something that grossly shows up on a physical exam, you're more or less given a pat on the back, told to get some rest, to eat better or whatever. And, you know, those functional that functional dysfunction that you actually have that allows you to keep going, but you know that you're not well, of course, that can become a greater problem down the road, but that affects your quality of life. And this points to the limitation of a conventional medicine diagnosis because it's rooted in pathology. Most of the problems that we have, until they assume a pathological nature, are functional in orientation. We don't feel well, we have difficulty waking up in the morning, we're stiff, we can't tolerate the cold or the heat. And you really have to have an expanded notion of what the human body is and who we are. You had an argument with your wife, or you lost somebody in your family, and now you're more subject to becoming ill, or you have frequent infections. So we need a different way to approach a person that isn't ready to go into the hospital and be admitted and hooked up to, a monitor. There has to be another way to really assess the areas of their lives that are out of balance and how that's contributing to whatever dysfunction is occurring.
I like that whole functional, or what does he say? Dysfunctional, functional?
Dysfunctional dysfunction.
Functional dysfunction. You heard it here first, folks. A term coined by Dr. Kokayi. So let's talk about the different type of doctors that we might find that could possibly be holistic doctors.
Well, again, holistic is an orientation. So any licensed professional can have a holistic orientation, meaning that they're looking beyond just whatever chemical test that they can order or their immediate physical exam to try to understand and interpret the symptoms and signs that a patient is presenting with. So a medical doctor has more of a biochemical orientation. A doctor of osteopathy, while having biochemical training, is much more in contact with the structural aspect of a person. Doctors of chiropractor are even more so with respect to structure, and many of them are also acquainted with kinesiology and nutrition, which give them an added insight into what I would call the software of the body in terms of how muscle dysfunction and even poor diet actually relate to some of the expressions of disease and dysfunction that people have. And then you have naturopathic doctors that get exposed to a wide variety of therapies, including allopathic medicine, homeopathy, Chinese medicine, nutrition, and they tend to specialize, although some might integrate some of these skills. And again, there's much more of a wellness model in looking at how do you get the body to return back to a state of wellness or even maintain a state of wellness. So those are just some of the professions that are actually practiced in this country. And all of them, again, they can be monolithic in their approach to health, just as any doctor can be. But a lot of the training of chiropractors and naturopathic doctors lends itself more to a holistic orientation than a pharmaceutically driven medical doctor education machine, I would say.
Yeah, absolutely. I'm sure that so many of us have had experiences where we've gone to medical doctors hoping that they would want to support us in our wellness approach, but maybe they're just not oriented in that way.
Exactly, and if you think about it, the term holistic medicine kind of first appeared on the scene in the 90s. There was a report by a Harvard epidemiologist, I believe it was Dr. Eisenberg, but I'm blocking on his name, that showed that more people were actually using non-traditional therapies and seeing their medical doctors. And for some reason that was a shock to the medical community. This is that, again, health food stores were already in existence, and it was clear that people were picking up vitamins and looking into other ways of taking care of themselves, and taking pharmaceutical medications, which admittedly caused many of the problems that people were having. So we had the idea of holistic medicine, which was more of a wastebasket term that referred to just anything else other than pharmaceutical-based allopathic medicine. But what happened is, as I guess more people began to incorporate this with their doctors and the doctors that were open to this, then we had complementary and alternative medicine. But even within this statement, the idea is that these therapies were complementing the traditional allopathic therapy, or in some cases even being used as an alternative to pharmaceuticals. And that notion survived for a good while until, I guess, physicians like myself that have been involved in this field for myself, it's been my whole career, going back to even my thesis in medical school, which is on physics and acupuncture, realized that what we're really talking about is integrative medicine. What's the really best practice model for any given patient with a particular problem? Or how do you really maintain wellness in a given population? So it's integrative because we don't want to throw the baby out with the bathwater with respect to the newest kid on the block, which is really allopathic medicine and pharmaceutical-based medicine, because there's still a role for drugs, and certainly there's a role for allopathic diagnostic techniques and methods. But in terms of treatment, there are many things that are safe and more effective than pharmaceutical-based therapies or even surgery. So integrative medicine gives doctors the freedom to explore that and still be doctors, but at the same time draw on the wisdom of other healing traditions, as well as doctors that have been in the field and have been using extending the biochemical model of medicine to include nutrition, and have been doing other therapies that have actually come out of that have come from other doctors and practitioners that have been able to figure out some other things about the body that become very useful, both in terms of diagnosis and therapies, such as applied kinesiology.
So it's kind of not just the best of both worlds, it's the best of all worlds, integrative medicine, just considering there's so much information out there that can be drawn upon. You're integrating it all together.
Exactly, and I think the public, because of the internet, who hasn't gone online to research an ailment or a disease entity, and who hasn't seen the fact that beside the drugs, there are countless other therapies that can actually be employed. So when you want to see a physician or be in a setting where you have an appreciation for, where there is an appreciation for these other therapies and the role that that might play in helping you to restore your health.
Very, very good information here, because I'm sure that many of us feel like it's either one or the other, but you don't have to choose.
Right, and again, the choice is yours, but this implies that there is a certain weighing that has to go on relative to what do I do? How do I spend my hard-earned money to really take care of myself? And so I want to talk about a framework that I've used that's really helped me to help patients to better understand their problems and for me to really function as an integrative practitioner. So I call this the four-pole model, and I came up with this when I was lecturing to I want to say lecturing to, but I was a guest parent for one of my children in the third grade class. And keep in mind that this child is probably about 20 or so. But I wanted to explain to them what it is that I do. And I realized that I was working, so I was using allopathic medicine, but I was already working outside of that framework. So I looked at the four major areas that seemed to embrace um, everything that I could conceive of both diagnostically and therapeutically. So there's a biomechanical reality to our existence. There's a biochemical reality. There's a bioenergetic reality, and of course there's spirit and consciousness. Now, different, oh, okay.
Mm-hmm.
So just to give you examples of some of these, so biomechanical, of course, within mainstream medicine, we're talking about surgery, right? We can also be talking about osteopathic manipulation. We're talking about massage, chiropractic, craniosacral therapy. In other words, anything where there's a real mechanical interface with the body that involves with some kind of manipulation or altering of the gross structures of the body. Biochemical, of course, we have pharmaceuticals, but there's so much more to the manipulation and modulation of biochemistry than the use of drugs. They're the basic building blocks of the body, the vitamins, minerals, amino acids, and enzymes, which doctors learn about during their first 2 years of school, but then it's off to pharmacology. And a lot of times this is all that a patient needs, whether you're giving these things as an oral supplement or whether you're giving these things intravenously. And then, of course, there's botanical medicine. My goodness, there are plant medicines from around the world that we have access to. Tons of information, good information, about the role that plant medicines can play in helping you to restore and maintain your health. And this all falls under what we call supplements, right? Things that are going to be supplemental to your food, and which of course we can't forget because clearly the quality of what you're eating, right, both in terms of the food itself and the degree that it's been adulterated, with chemicals, with pesticides, all of that plays a role in determining the biochemical integrity of a human being. And then there's understanding or working with the body's energy field. And acupuncture, of course, is the main thing that comes to mind. Acupuncture points are points of least electrical resistance on the body's surface. This research goes back to Yoshio Nakatani of Japan in the 1950s and Reinhold Voll in Germany that showed that most acupuncture points are actually measurable, right? And a practitioner can actually learn to palpate and feel these points. You can use acupuncture pens, you can use lasers, ultrasound, you can use any type of a frequency to manipulate that acupuncture point, which then affects the chemical and structural body. So now we're talking about something that really can begin to manipulate your chemistry and your physicality, but in and of itself, we're really talking about an electromagnetic field, or something like kinesiology, where you're not really measuring muscle strength, but you're measuring the energy, literally the energy of a that's going through a muscle to determine if something's out of balance. Or as in Chinese medicine, pulse taking, where you're literally palpating the wrist and feeling the energetic vibration that's coming under the fingertips. But it's almost like a note on a guitar string. They're different notes that tell you different things about the body. And of course, my favorite is the spirit consciousness piece, which when I did my thesis in 79-80 on physics and Chinese medicine, I looked at medicine in general, And we could see that modern medicine or allopathic medicine was rooted in classical physics. Acupuncture was rooted in electromagnetic field understanding of the body, which really didn't happen in Western society until the late 1800s with scientists like Maxwell and Faraday. But now, in the 20th century, and going into the 21st, we're talking about quantum fields. We're talking about zero-point realities where a person can go to in their prayer and meditation that actually can begin to shift things that actually happen on a physical plane. As we all are acquainted with the idea of miracles and miraculous things happening, that's still falling within a science framework, but it's a science framework that goes beyond our everyday reality, but it's understood by physics. So within this framework, we have prayer, meditation, hypnosis. We have the type of energy medicine called biodynamic therapy. There's another one called pranic healing. Even talk therapy. All of these are capable of manipulating the body at a very fundamental level where energy is becoming matter.
Wow, that's really profound. So where energy becomes matter, that's something probably that for most of us that just kind of blows our mind, right? It's pretty amazing to understand that there's so much out there with regard to holistic medicine.
And this is why early on I really became interested in medicine as a cultural expression. Medicine is really a cultural expression because within that, culture really determines the way that we frame a problem, the way that we understand our reality, the way that we just organize information. So different cultures emphasize different things. So if we look at Western culture per se, the main focus has been on the materiality of life. And there are all kind of things that we can say why that's the case. If we look at, Western history and just the kind of climate that was in Europe and just what survival meant, that focus, has given rise to a really prodigious system of healing and science. The word science just means to know. It's like, how do we come to know things? So Western science or Western epistemology is a way to look at the world in a particular way. If we shift to something that's almost on the opposite end, if we look at African culture, no one really has heard too much about African culture or healing. But in the same way that we look at Native American or South American indigenous healers, there seems to be a reliance on the power of the word, the ability that your words actually can cause illness, that your words can make a difference. But this is taken to a whole nother level in terms of the manipulation of consciousness, right? The use of rituals, the channeling of energy, diagnostic systems like divination that rely on quote-unquote chance to unlock the secrets of what's happening in a person's life. Now, it's interesting because I've had the opportunity to study African traditional medicine up close as a filmmaker and someone that traveled and interviewed traditional healers. And I remember when I was in Mozambique and I interviewed two women who looked to be European, but they actually identified themselves as being from Mozambique. And they said, well, we use biomedical medicine is the way they framed it, but I was staying with a traditional healer, and they said we also use these methods as well when we want to know what's going on around us, when we want to understand how the problems that we're experiencing in our body are related to things going on in our environment, to our work, to our family and relations, right? So what we have is in the human family, we have different cultural streams that have produced cultural technologies that allow us to begin to get a better understanding of the entirety of human reality as it relates to health and disease. And it just seems that as we move forward, that we want to take advantage of the gifts the different cultural systems have to offer as we come up with a complete healing system to deal with all the ills of the world. So other models of medicine, I've mentioned Chinese medicine with the understanding of energetics, of life energy, of qi, and how qi is something that is a life energy that's not necessarily material, but is energetic in nature, but then that each organ system has its own particular type of qi. Food, or wu qi, has its own qi, right? So that appreciation really helps us to figure out how do we augment the qi of a particular organ, or in a particular disease, what's the kind of qi that's actually needed to turn the problem around, to change life energy. Holistic Western medicine, I've mentioned applied kinesiology and muscle testing as a way to get into the body's intelligence. It's almost like using a muscle. You can pose different questions to the body, and the body will respond not from just what you're thinking, but what the body actually knows to be true in that particular situation. And there are just countless ways to use this technology to assess what a person needs and what's actually going on with them.
So many different tools available to you as a diagnostician.
One of my favorite, and something that really helped me to get out of the Western medical mindset, is homeopathy. Now, homeopathy is clearly a Western medical system, but at the same time, it goes beyond the basic biochemical model, because you're actually you're making an energetic blueprint of material substances, and you're looking to see how that energy is capable of affecting the physiology as well as the mind of a person. So homeopathy has been poo-pooed by Western doctors for a long time because the of medicine are subatomic. They're beyond what's called Avogadro's number, where you can find even a single mole of the original chemical unit. But yet, with the technology that we have now to actually look at subtle changes in molecules, you can see that a homeopathic remedy, when added to water, totally can change the molecular configuration in terms of the level of connectedness between the hydrogen and the oxygen molecules. So homeopathy itself is actually real in terms of what it can actually, the fact that it can actually make changes in the body, but it's a real art. Just like Qi Kung. I've studied with Qi Kung masters, and it's amazing to have a Qi Kung treatment and be enveloped in that energy, and to actually see what you can, through training, learn how to pick up from a person's energy just by running your hands over their body, and then learning how to project energy through you into their body in areas that actually need it. It's really mind-boggling.
And just to be clear, for people who are not quite sure what we're showing here on the screen, on the left you have the homeopathic remedies, the little sugar pills, and then on the right the Qigong, somebody actually practicing that.
So, I think that the future of medicine is truly going to be an integrative one, because the dynamics of economies are changing. China's having a much greater prominence. Clearly, India, clearly even the NIH, with setting up a department to look at quote-unquote alternative medicine. The money coming through that department has just grown and grown each year, as many of these techniques and things are now have come under study. I think the interesting thing, though, is that once you go beyond the biomechanical and biochemical model, it's very much about the energy of the practitioner. Gone are the days where you wouldn't expect a holistic doctor to be, standing there smoking a cigarette. Why? Because the energy of the practitioner becomes so crucial in these other forms of healing. And in various traditions, you had to have a high level of functioning. For instance, to graduate from a traditional school of healing in Africa, you would have to demonstrate your psychic abilities. You would have to be able to find anything that was hidden in the village, right? In Chinese medicine, you have to be able to read pulses. You have to know where these acupuncture pins need to go. So Western medicine is more of an intellectual process. And to be frank, to do holistic or integrative medicine, you have to be able to dance. The practitioner needs to figure out what kind of dance they want to do. And then where it fits, they'll be able to actually help you because they'll have some mastery of some energy principle that they can really work with.
So that's maybe even just addressing the very nature of the practitioner, right? Being strictly intellectual versus open to other ways of being.
Right. I think going on to days where it's just about intellect to heal. I think who is it on? What's it? Dr. House? I mean, look, folks, I hope you're not taken in by that. One, that is in a hospital, so they are facing those kind of real intellectual challenges. But you don't even want to be in a hospital. You don't want your problem to come to the fact that you have to be in somebody's hospital, given all the morbidity and mortality associated with just being in a hospital. You really want to figure out things before you have to go there. And to do that, you really need an integrative approach to really understand what's going on with your mind, your body, and your spirit.
So then who to pick to be your partner in wellness so that you can hopefully avoid as much as possible being in a hospital?
Well, I think the challenge for patients is to figure out, well, what kind of practitioner do they need? For instance, if you have low back pain, well, an allopathic doctor is going to give you muscle relaxants and pain medicines. That may not be the best thing for you. You might do well with chiropractic care or even acupuncture. So part of it, the whole problem is really in coming into an integrative center is almost like you need to be triaged. I remember I had a patient who had reflex sympathetic dystrophy. Complicated name, but basically to say that they had chronic pain in a limb after an injury. I mean, just limb constantly in pain where they could barely just touch the ground without feeling exquisite pain. And they had been to many doctors for pain medicine. Well, basically after I saw them and I realized that the problem was coming from the pelvis and required a simple manipulation, and I did that, and for the first time in several years, she said, wow, I don't have any pain. At first they were very happy, and then they got angry, not with me, but how come nobody's done this before? How come we've just been taking all this pain medicine? And I tried to explain that you saw the wrong kind of practitioner, right? You saw that your problem really couldn't be solved with the knowledge base that the mainstream doctor had. Likewise, I've seen children that are on psychotropic medications for anxiety. I had this one child came to my office, was just falling asleep. They were on so many drugs. It turned out they had all these hidden food allergies. Once we removed certain foods from the diet, the child was able to get off of the drugs and is able to function normally in class.
That's amazing. And that's a really important lesson, too, for a lot of parents out there who already feel kind of in their body, I don't know if this is right for my child, putting them on these medications. I wonder if there are other options.
Right. Well, certainly you want to try to explore other options. And if you can find an integrated facility like Patients Medical or similar facility where you have practitioners that have, I call it cross-training. as a practitioner in primary care, you have to be cross-trained because it's just not enough to know how to prescribe drugs and to diagnose disease and pathology. You have to be aware of nutrition and hopefully take some training in something that crosses that biochemical, bioenergetic divide, right, that allows you to get into the energetic makeup of a person.
So that kind of leads us to our list here. So finding a practitioner or a doctor that's even just aware of these 4 things that you've been talking about, that's the first step.
Right. I'm looking at these again, and the last piece, this is the medicine of the future. Find a practitioner who can practice quantum healing. I must say that's something that I'm working on because the idea of why do some people have something miraculous happen where something that was disease, that was full of lesions, all of a sudden disappears, right? That's still happening within this physical universe. So that means that they're tapping into some laws of physics or some aspect of the electromagnetic spectrum or consciousness that's capable of creating those changes. So what I'm most interested in is seeing how that can happen in a more frequent or repeatable fashion.
Okay, so, and sometimes we might think, okay, gosh, how do I find one of these types of holistic doctors, especially somebody who practices quantum medicine? I mean, it sounds like, God, where would I even go to find these? But you say that it's becoming more prevalent.
Right. I mean, if you look up quantum healing, there's matrix energetics, matrix reprogramming. There's I'm blocking on some of the therapies that are out there, but there are really some fantastic systems that are around, and part of this is to learn so you have your own internal practice, whether it's prayer, meditation, so you're cultivating that connection, that deeper connection, whether you call it with God, the quantum field, 0-point energy, or whatever your cultural framework is, to develop that deeper internal connection as you learn more about nutrition, as you learn more about other systems of healing that can help you and your family.
Excellent. Right. Now, so we have a couple of questions here from people who have written in. They're, kind of standard questions that we get here a lot at Patients Medical. But just to kind of go over these with the doctor to get the doctor's perspective on what to do here. So the first one is, when I'm looking for a holistic doctor, what sort of qualifications or standards should I look for? So this person's really trying to figure out, okay, so for more conventional medical doctors, you're going to check and make sure that they are actually doctors, or you're going to look up and make sure that they're licensed in the state of New York, they're board certified, or something else like that. For holistic doctors, is the process the same?
The process can be a little bit different. For instance, with MDs don't actually have to they don't have to go through a 3-year program of Chinese medicine, right? Or they don't have to go through a 3 or 4-year program of homeopathy. They tend to accumulate these skills through courses, workshops, seminars, or training. The question is that what they do? Right? So, yes, you want to see that the practitioner has some other qualifications in terms of certifications, but you want to see what is it that you practice on a regular basis? What are you known for? It's always good for word-of-mouth referrals with doctors rather than, it used to be that everyone wanted to be board certified as a doctor. It just means you know more and more about less and less. Right, so
that's pretty funny.
I really think cross-training, as a doctor, are they familiar with chiropractic? Are they familiar with kinesiology? What systems, do they practice, and what's their training? Just ask them, what's your training in that background? And again, between that and word-of-mouth referrals, you'll be able to figure it out.
Great advice. All right. And what are the main differences that you can expect when you go to visit a holistic doctor compared to the conventional physician? Now, obviously you spent a great deal of time speaking about the difference between them, but, when you arrive at the office, the intake process, the first few minutes with the doctor, how's that going to be different with a holistic doctor?
Well, every holistic physician, again, is going to be different. And again, holistic is a wastebasket term. So you're really looking for, from a medical standpoint, you're really looking for an integrative practice. An integrative practice where the doctor is not just giving lip service to other therapies, but they actually do some of these things. Or they're at least trained enough that they can triage to the appropriate person that's working within their facility, right? So the main difference is that a lot of Western docs or allopathic doctors stop at a diagnostic term. You have gastritis, you have bronchitis, you have arthritis. Within a holistic or integrative framework, there are so many more questions. In fact, what I try to do is get patients to drop the medical verbiage and just tell me, what are you feeling? What's happening? When does it happen? Does it happen, with what other set of symptoms? What's the quality of the pain or discomfort? So you're really trying to find out what the life force is doing, and there's less focus on a diagnosis. At the end of the day, fine, you can use a diagnostic term, but that in and of itself isn't going to, help you to heal the person. So arthritis doesn't mean that you need Advil or Motrin. Well, what's the cause of the arthritis? Then that opens up a whole another exploratory piece that in a holistic medical setting, either the doctor will go through that question with you, there'll be other forms to fill out, there'll be doctor's extenders that can work with you to really get more of a complete picture of why you have what you have or why you feel what you feel. I mean, if you think about it, psychiatric medicine has more or less been reduced to a prescription of drugs. We're figuring out how to combine them or when to use them, as opposed to the art of actually healing the mind, of healing, of reconnecting the person to their soul, so to speak. So all of that, if the person is ready just to prescribe you medication, then you're probably not in the right place. You want to feel like you've been heard as a patient. You want to feel like that the doctor has somehow reflected back to you some understanding that lets you know that, one, they got it, or might even be a surprise, wow, I didn't connect it all that way. This has been happening to me. I can think of countless examples of that in going through a person's history and getting them into the zone where they really will talk about themselves and what's going on. And then you can understand really how their whole life has unfolded, why they're even doing the work that they do. You can see the series of things that have happened that have led them to that particular point. When you feel like you thoroughly have been heard and understood, then you have a better chance of being healed or being helped along your way in whatever healing process you're going through by a practitioner. And that's a very organic process, and it's something that you should look for, and once you have it, it's going to be hard to settle for less.
Absolutely, and that's really, I think, all most patients want is just to feel heard by their doctors. And just as a side note, just some of the things that I hear that patients notice when they come just to patients' medical, I can't really say what other holistic medical centers the experience is, but they say it's like a combination of being at a doctor's office and a spa, and that just the feel of the people who work here is much more relaxed, much more welcoming. It's a bit more of a comfortable place to spend an extended amount of time. They're with the doctors as opposed to feeling rushed through and only having a few minutes with the doctor. You're probably going to be with the doctor for a half hour, 45 minutes, maybe even an hour. So these are some of the things that I've heard from our patients. What they really notice is the difference between a conventional practice they've been to and holistic practice. And the next one is, are holistic doctors, able to prescribe pharmaceuticals or just supplements and herbal remedies?
Well, they're licensed professionals in New York State, and they have a scope of practice. So, sure, if you're an MD and you're doing integrative medicine, you can use pharmaceutical medicines. If you're a DO, the same thing. If you're an MD, well, you're still trying to get licensed in New York State. So different professions allow for different access to the drug world, and it's rare that an integrative medical physician will not use pharmaceuticals at some point. I mean, for instance, I have patients that are hypertensives and diabetics. I'm going to have them on their medications, but I'm going to try to show them how we can create an exit plan so that they can get off of these medications and reverse some of the underlying causality that's created a situation where they need these drugs to prevent a stroke or to prevent their sugar from being out of control.
Absolutely. And so many patients that I've heard say, I asked my conventional doctor, so doc, do I have to be on this medication for the rest of my life? And the doctor said, yeah. And I said, what do you mean? Why? So that's exactly what you're talking about. These people just do not, they understand that they might need to go on it short term to get themselves out of a health jam, so to speak. But long term, they don't want to be on these meds for the rest of their lives.
And what the shame is that there are many bright and intelligent people that go into medical school and become doctors, but it's the programming. It's the programming that short circuits what's possible and what shouldn't be possible. It's the limitations on the thinking. It's the way to organize information. I mean, if you have atherosclerosis, does that mean that you need to be on statin drugs? Well, most doctors will say yes, we have to control this or that. But, that practice changes every 10 years, and they're on to something else. But, you really want to get, as you go along your life path, you really have to learn more about your body. You're going to be the one that tells the doctor, no, I think I have this. I think this is going on. Because you have to get in touch with your body. I don't think any of us can afford to be sick and laid up in a hospital these days. You really have to maximize your health potential. And that really starts from the moment that you rise in the morning to what you do is the last thing at night.
Taking on that responsibility yourself. So the last two kind of go hand in hand. And I know that you probably spend a lot of time talking about when you should see a holistic doctor versus a more conventional doctor, but maybe just go over a couple circumstances where it would be appropriate. Let's say you're a parent, right, and you have a child, and you'd like to take the holistic approach. Are there any instances where conventional medicine would be advantageous, or only go to a doctor who practices holistic medicine first?
Well, I think in many cases, you want a conventional medical diagnosis. You want to at least have some framework to start in. And granted, their diagnosis might be limited, it might be this or that, but and you don't want to hang your hat on that. But sometimes, because we're all have been caught up in the regular medical system, that's a good place to start. What happens is a lot of people, in seeking out care for a problem, then they go to an integrative practice and they get better, and then that's where they start. So then if they have another complaint that comes up, they go back and they start within that framework. So the diagnosis may not be the emphasis. But for instance, if you're having chest pain, you're middle-aged, and you've eaten the traditional American diet, well, you don't have holistic emergency rooms. You go to make sure you're not having a heart attack. I mean, you want to know that, If you're a child and all of a sudden you're having diarrhea and fever, and you don't know what's going on, yeah, you probably want to take your child in to see the pediatrician to get an idea of what could possibly be going on. I think, a lot of the measures that are taken in the emergency room are adequate, but where allopathic or Western medicine really falls down is with chronic care. It's like, well, how do I actually get well again? Am I, like you said, am I going to be on this medication for the rest of my life? Do I have to just be on these pain medicines? Do I just have to accept that this is going to be my condition? I think that's where you need to go beyond allopathic therapeutics and see what else is going on.
Great. So it sounds like really, for the emergency medical care, am I having a heart attack? Have I just severed my finger? Is my child, in an emergency?
Yeah, your child had a seizure. Mm-hmm. You're going to go into that setting. Does your child need to be on drugs for the next 5 years? Well, that's a question that depends on, testing and to see what other options and things are available. Does your child need a craniosacral adjustment to actually make a difference, in terms of that seizure focus? Are there some homeopathics that actually might make a difference? Or are you going to put the child on this medication? Those are all questions that are at some of the cutting edge of therapy. And what you might find is one integrative practice that will focus on children that have ADD, ADHD, and they accumulate the experience and the technique, incorporate the techniques that allow them to treat those children without Ritalin.
Absolutely. And just a note there, we do have that type of practice that you can explore that here. So if you're looking for where to go and you are in the New York City area, Patients Medical, Dr. Kokayi, these are definitely resources you need to know about, you need to check out. So I just want to thank Dr. Kokayi for his wealth of knowledge here and really breaking it down for us, the difference between holistic and conventional medicine and the many nuances. Thank you, Dr. Kokayi.
Well, thank you. I look forward to seeing some of you here in the office.
And so if you want to know more about Patients Medical, go to patientsmedical.com. That's PATIENTS medical, MEDICAL.com to get back on track with your health or with your family's health. Do you have a question? I'm sure that you do after all this information. After you let it kind of settle in, you probably have some questions about how this applies to your health or your family's wellness. So give us a call. We have new patient coordinators who are on the lines during business hours, and they actually can answer many of your specific questions about how our holistic medical doctors, including Dr. Kokayi, can assist you in your wellness care needs. We have a variety of different holistic medical doctors. So starting with the left on the top is our medical director, Dr. Rashmi Gulati. The second one over from the left on the top, that's Dr. Kamau Kokayi, who you've been hearing speak today. Next to Dr. Kokayi is Dr. Deanna Howard, Dr. Thomas Goforth at the top right corner. On the bottom left corner, we have Dr. Bettino. He's our holistic oncologist. He also does hematology and immunology. We have Dr. Weg. He does pain management. He's here, alternative pain management specialist. Dr. Vivian Denise, and she's a holistic pediatrician. And the bottom right is Dr. DiFrancesco, and she is our psychopharmacologist. So you can find out more information on all of these doctors as well as their bios, video clips of them, things that they have written on our website, patientsmedical.com. Here's a little bit about Dr. Kokayi and his bio. Read the complete bio on our website and then get more information. You can watch a video of Dr. Kokayi, who was on the news recently talking about nutrient IV therapy. And do just contact us, reach out to us by phone, 212-661-4441, or you can email. The email will come to me personally, Megan, at media@patientsmedical.com. That's MEDIA @patientsmedical.com. We do look forward to hearing from you, and whether or not you think it's the perfect fit for you, just give us a call, and we'll have a conversation about it, and we'll decide together how we can assist you best. So thank you so much for joining us today for talking about holistic medicine and what is it, why you might want to choose it, and we look forward to assisting you in the future.